We've got a community here that are very low socioeconomic status and have a significant healthcare needs, and we also have an area where there's not enough access to healthcare services. So we know, in the private sector, people are waiting 2 years to see an allied health professional. So it's about finding those really most vulnerable children and families that need support, that aren't accessing services, and we know they're out there, but actually linking them in and then in a supported way bringing them into the health service, and as much as possible trying to get them to see as many things as they can on the one day. In an area like this, families don't just have health problems, families have social problems. But by working holistically and looking at the social needs as well as the health needs, we're trying to hopefully, build them up to a position where they can, look after themselves, because they've been linked in, they know where to get the services they need to help them.
You can't do it all by yourself, so it's really great to have the allied health team, and they're an amazing group. I've learnt so much from them, and they're so willing to just jump on board and share information about what's best. So we've had at times where the speech pathologist has spoken to the dietitian, and then that information share about what this child is needing and experiencing has been wonderful. So just from the health side of it, that's been really great. In terms of from the wellbeing side, it's around supporting families to link in for those other additional needs that might be there in home, or some linking in with some parenting supports, parenting groups as well. So in terms of those partnerships, it's really just supporting a wraparound kind of service from both the health and the wellbeing.
Have managed to embed themselves into the team, and the amount of cross-referrals, case conference discussions, and the way the whole team are working more collaboratively for the best interests of the child and the family has been really significant.
Probably the most complex child they've ever had. So it was a 5-year-old girl who was living at home with her family, hadn't been accessing services at all, hadn't been in the education system at all, had her early maternal and child health appointments, but then nothing really. The child was non-verbal, had a multitude of health issues, didn't even have a birth certificate. It was simple things like that. So the team worked with them to help them get the birth certificate, because then she can, that helps you with so much. You need your birth certificate for everything. They got the child in with the dietitian. It's the one that the counsellor went out and saw at home. So they got the dietitian involved looking at the diet, because the food they were eating at home wasn't healthy. And the child had assessments with all of our allied health teams, the speech and OT and all that, and a plan made. We've helped get this child into school. So just the outcomes, not just health but education. They've also, in the time they've worked with the family, they've worked with the parents as well. So mum has diabetes, she was not getting any help, she's getting help now for her diabetes. So it was a whole family approach. They've actually worked with, it's not just, we're going to do this child in isolation. They've actually worked with the whole family and improved the whole family's health.
And then we've got children who are then diagnosed, medicated, supported, and you can see the increase in attendance at schools, kinders, a reduction in some of those challenging behaviours at home as well. So generally speaking, there's lots of little areas of success. Yeah.
From my own point of view, probably one of the biggest things is the team spirit at the Paediatric and Youth Hub. People in our OTs, our speech, they can now do their core business. They don't have to be worrying about the other stuff, because generally Beck and I are on top of that, or if they come up with something, they don't have to deal with it. They can ask us, and we'll take it for them, and they can just deal with their core business rather than doing all the other stuff as well.
I think in January we had 80 client contacts, which is phone calls or visits or whatever. We're now having nearly 300 a month. For every family we help, that's one not falling through the gaps. There's probably still some out there that are, and we need to find them. But I just think when you look at the case studies they put together and the outcomes they're getting, it's just, that's what we did it for.
I think a lot of the people that live in these communities chose to live out of mainstream. They will self-medicate, self-soothe, self-diagnose, and die early because they haven't sought medical attention.
They're a group that are medically underserved. They've been marginalised from society for a long time, but we also look at them with a health strengths-based approach. And what they bring is a lot of resourcefulness and resilience, excellent problem solving. And what we found is by connecting them with services and trying to address some of their unmet healthcare needs, we're looking at it with a preventative focus that this will help to avoid costly hospitalisations further down the track.
We were able to do video telehealth with GPs, so people can have one-on-one, whether it be for prescriptions or referrals. Pathology results, we do pathology. We can do ABIs and ECGs.
A really important partnership is around pathology collection because particularly for people who need fasting blood tests or regular blood tests, a distance of 2 hours in each direction to get a blood test and fasting is a really big ask of people. And then with people who see specialists much further down the line, the ability to have telehealth consults and to avoid all of that travel as well has just been really life-changing for people, and we're offering them convenience.
Being able to do anything from here is like a miracle for us. I feel heard by Sharon, I feel understood by Sharon. I feel a kinship, a friendship with her as well. I feel like she understands our community, and what a treasure to have someone like her right here, like from our community, working with us.
And I think this program's unique in that we really recognise and celebrate what the community are bringing to the table. We talk about it a lot in healthcare, and we also talk at a health system level about needing a critical mass to make it financially viable to deliver health services. We are in such a privileged position to be able to try an innovative model that can be scaled to other places around the country that are isolated communities as well.
I think just those moments, and they're not every day, the moments that you get that you see that trust and the change in somebody, and they want to live, and they want to live a bit better.
I wasn't getting anywhere with my medical stuff. I felt like I was in a million different pieces. And I feel like I'm going to cry now. Sharon put them all back together,